forget to press the bell icon. Healthy Wrinkles, all about healthy living.
So the elderly, as such, are more likely to have some of the complications related to hypoglycemia. Because elderly, what happens? Most elderly patients are generally long-standing diabetics, and they might be on multiple OHAs. They might be on insulin. They might even be on sulfonylureas. Many of them might even have hepatic impairment, renal impairment, and there are also two conditions, what we call as hypoglycemia unawareness or hypoglycemia associated autonomic failure. So, in that, what happens? There are elderly people who do not have the symptoms of hypoglycemia at that range of 54. So, 54 is a warning sign when normally people will have symptoms, but here they do not have these symptoms. It is bypassed and they directly go into the neuroglycopenic stage where they might fall unconscious. So that is why it is very important for elderly people to first of all identify the comorbid conditions that are coexisting in them. Then accordingly we can take measures, give them the suggestive advice in order to prevent and avoid hypoglycemia. In such cases where we know that they are prone to hypoglycemia unawareness or they might have hepatic or renal impairment, we might even relax the glycemic control. So we might maintain the HbA1c 7 to 8% or even above 8% in some instances, because hypoglycemia can be more lethal than hyperglycemia. In fact, many studies have shown that hypoglycemia in the immediate period can trigger arrhythmia. So if it triggers a arrhythmia, then it can immediately go into a cardiovascular death. So the person can die because of that. They can even go into cognitive impairment. They can go into coma, where they might have to be hospitalized, and recovery from coma can take many days or they might not even recover.